Hello everyone, my name is Garrett Myrne and it's my pleasure to be here with you today. I'm joining you from Vancouver, Canada. This is where I live and I work at Radiant Life Technologies. I have for the past decade and I'm the regional manager for North America. And today we're going to be joined by my very good friend and our Director of Research and Development at Radiant Life Technologies, Dr. Arjan Surzakov, and he's going to be joining us from Russia via the internet, of course. So today we want to present to you coMra-Therapy. Now this is a breakthrough medical technology, and this is designed and developed and produced by Radiant Life Technologies in 2009. We're excited to share with you about coMra-Therapy because after a decade of clinical use and applications, we believe that coMra-Therapy can be of huge benefit to so many people around the world who have vision problems. Our mission at Radiant Life Technologies is to help people help themselves. And everything we do is aimed at empowering the individual through holistic self-sufficiency. Today we're going to talk about coMra-Therapy. We're going to talk about coMra device. We're going to use our flagship device for that purpose. We're going to talk a little bit about the science, just a little bit. And most importantly, we're going to share with you cases submitted to us by doctors. And today we're going to select cases from United States and Latin America. Now a little bit about the title. When we say restoring vision cell by cell, just very briefly what we're talking about is inside the cell there's an actual self-repair process. And coMra-Therapy addresses and supports and restores that process. And this means the cell gets healthier and hence vision improves, things are restored, hence the title, Restoring Vision, Cell by Cell with coMra-Therapy. Now for those of you, I hope you'll sign up for the workshop. For those of you who do, what we'll do there, we're going to go through things in more detail in this presentation and we'll walk people through step by step how to apply coMra-Therapy for eye conditions and eye-related conditions. And we're going to use real-life examples for this. And for those related conditions, what I mean is, let's say, neurodegenerative conditions and endocrine disorders and many other things. Because what happens in the eye is also happening in other parts of the body. And we can treat those other parts, that self-repair system in those cells, in order to get better health with vision. So like I said, we'll go into that more there. Hope you'll join us. Now, what is coMra-Therapy? So coMra-Therapy is a very unique combination of 4 most effective and non-invasive therapies, and these are all coherently combined into one whole and applied as one therapy. And the word coMra is an acronym and it stands for Coherent Multiple Radiance Therapy. So coherent coMra-Therapy, Coherent Multiple Radiance Therapy. Now you'll see on the slide the Delta device. This is that flagship device I was telling you about for coMra. And when you look at that, there's some numbers corresponding to places on the device. So the infrared laser is right in the center. The infrared laser therapy, number 1. Number 2 is the color therapy, and this is around the perimeter of the device. Number 3 is the magnetic field therapy, and this is inside the device. You can't see it, but it's part of the application. And then number 4 is the ultrasound therapy, and you can see those little round circles around the laser in the center of the terminal, of the delta terminal. So now if you get coMra-Therapy, it's not going to make too much sense on what to do with it without some guidelines. And coMra-Therapy comes with a very comprehensive set of guidelines for different different conditions and treatments. And you'll see here one treatment protocol. And this is for macular degeneration, retinitis pigmentosa, and glaucoma. This is a part of the treatment. Again, when we get into the workshop, we're going to go into this in more detail. And with this, also, just as a note, you do not need special training to use it. Take it out, follow the book, and it's very self-explanatory. However, for clinicians and doctors and therapists, you're going to want to take that course in order to learn more about what's going on with coMra-Therapy, because you'll be applying it with other therapies and all of these things, which it works in combination with. It'll support every other thing you're doing in a practice. But also it can be applied for home users in the sense that the course, the training, some people when they buy, if I may use an analogy, they buy a digital camera, they just set it to auto, it takes really good pictures. This one here, for example, that I'm using. But some people want to take it off auto, put it on manual, and actually learn the art of photography and the science of photography. And it's much like this with coMra-Therapy. You can learn the art and science of coMra-Therapy through the training, through the courses. And in conjunction with this, there's also support and consultation as required if you need it. When it comes to application, you simply place it on the injured, insulted, damaged area, and all the therapies are going to penetrate into that same volume of tissue down into the cells and address that cellular self-repair system to restore it within the cell. And as those cells, like I said earlier, as their health is restored, then what they are a part of, let's say something to do with your vision, then that's going to restore health to your vision as well. So now what I'd like to do at this point is hand the presentation over temporarily to our Director of Research and Development.
Hello everyone, thank you Gareth. My name is Arjan Surazakov and I'm the Director for Research and Development at Radiant Life Technologies. I'm joining you today from a coMra-Therapy Center for Regenerative Medicine from South Siberia, Russia. Here we are. In our center we treat a very wide variety of conditions, including neurodegenerative conditions, recovery after stroke, cerebral palsy, and of course eye diseases. So our experience during the last almost 10 years from around the world and now from this center is showing us that coMra-Therapy can play an essential and sometimes a key role in a holistic integrative treatment program which is aimed at the protection, repair and regeneration of the cells in the eye and in the brain that has suffered an injury in a neurodegenerative situation. So let us take a closer look how coMra-Therapy works and how it can help you in your condition. I would like to use a practical example of someone with glaucoma. Well, actually it's my father. He's an artist and he's an author of this painting and many other paintings that we have here around the center. So you can imagine that for him the ability to see color, to perceive shape, proportion, to see at a great distance and up close is really a major part of his life. And about 12 years ago he started to have difficulty with his visual fields. He started to see double and he has a big loss in acuity. So for someone like him it was a very huge distress, and later on he was diagnosed with glaucoma. So in this condition what we need to look at is a state of the cell of retinal ganglion cells, because in glaucoma what actually happens is that these cells that deliver visual information from the retina all the way to the back of the brain, to the visual cortex, is now suffering injury. What happens in glaucoma, and the reason why he started to have these visual field defects, is actual injury to the retinal ganglion cells. These cells of the optic nerve are responsible for delivery of visual information from the retina in the back of the eye all the way to the brain. As these cells get sick, at first the electrical signals they carry get distorted, but as injury becomes worse, eventually these cells stop transmitting information altogether and later they die. So this leads to a progressive loss of vision because each of these cells is responsible for carrying information in a particular area in the retina. So the next logical question is why these cells get injured. And there are many factors that we must consider when we're creating a comprehensive treatment program. Increased intraocular pressure, lack of nutrients, toxins, too much work, emotions. So all of these factors must be addressed in order to reduce this external load on a cell. But there is another problem, because when a cell is damaged, its ability to self-repair is also impaired. Its internal structure is so damaged that it cannot produce enough energy, it cannot synthesize new building blocks, it cannot absorb all the vitamins and nutrients from the outside. So the problem is not only to remove the external causes of injury, to a degree it's possible, some factors we cannot remove, like aging for example, but the other side of the equation is also very important. So what can we do to reach inside the cell and help it to start rebuild itself? That's the next big question. And actually there are a lot of things that we can do. During the last 40 to 50 years, there have been a growing amount of research showing that we can use different kinds of energies to penetrate into a cell non-invasively. Meaning, we can do this without disturbing its internal content, without interfering into its internal function, but only to modulate and stimulate those processes that contribute towards cellular self-repair. Here in Russia, I'm showing you national guidelines for glaucoma. Several kinds of therapies were found to be effective for treating glaucoma. We're talking about low-level laser therapy, magnetic field therapy, color phototherapy, ultrasound therapy, and microcurrent therapy. Each of these therapies were found to be effective and influencing the internal function of the cell in its own particular way. So it is not really surprising that many clinical trials conducted here in Russia found that for the best treatment effect, a doctor needs to combine at least two of these therapeutic factors. So when coMra-Therapy was brought to Russia, the coMra-Delta device was approved by the Russian Ministry of Health, the analog of FDA here, on the basis that this technology, the coMra-Delta device, essentially brings together the best from what science and clinical practice tell us. So the coMra solution to the challenge of cellular self-repair and regeneration is to provide support to a cell in a comprehensive and completely safe way. Magnetic field and infrared laser are known to enhance energy metabolism in a cell. Color LEDs, color lights, and the laser are providing regenerative messaging to the cell and the whole of nervous system, while ultrasound assisted by a magnetic field provide very gentle vibration and enhanced speed of molecular transport and structural repair. So in a coMra device we found a way how to coherently combine all of this energies into a single therapeutic vortex, and at the same time we decrease the intensity of each type of energy so that the use of the device is completely safe to application on the eye, on the brain, and actually on any part of the body. So first of all, the action of coMra radiances are universal to any type of a cell. This is why you can use coMra-Delta device to support cellular self-repair in the optic nerve, in case of glaucoma, or in the retina in case of macular degeneration, or diabetic retinopathy, or retinitis pigmentosa, or pretty much in any type of a cell in any part of the visual system, in the eye, in the nerve, in the brain. And second very important implication is that because coMra-Therapy devices are so safe and do not cause any negative side effects, these devices can be used both in doctor's office and also at home. So in case of my father, and now he is using a coMra-Delta device for about 8 years, he noticed very significant improvements in the visual fields, in his intraocular eye pressure, very fast, weeks after starting the treatment. But he also told me that when he paints for about 4 to 5 hours on a daily basis, he's very active, he gets tired and his vision again starts to get worse. So, and also when he stopped using Delta for several weeks, so let's say for 3-4 weeks, then also his symptoms of glaucoma start to come back. So we realized that at his age, he is 69 now, it is no longer a matter of a few coMra courses during a year. He actually needs a constant support that he must do practically on a daily basis. So the way how I explained to him is very much like oral hygiene, when we brush our teeth every day. So that's how my dad need to approach his vision, because on one hand, this is age, he's 69, but he also works very hard as a painter, as an artist. So his vision, his visual system gets a lot of workload. So he does need to take a daily care. And this is why he has a daily device at home, and he works up until now.
So to summarize, coMra-Therapy contains 4 different types of radiances: infrared laser, magnetic field, ultrasound, and color therapy. And we did so in order to have a synergistic effect on the processes of self-repair and regeneration inside each cell in the eye, in the optic nerve, and in the brain. Why we need to combine so many different radiances? This is because the processes of self-repair occur at 3 different levels. We need to address the energy deficit in a cell, the structure and speed of metabolism in a cell, and finally we need to address the communication challenge inside the cell. So we combine these 4 radiances in order to have a synergistic effect on the process of self-repair. Thank you very much. Back to you, Garrett.
Thank you very much, Arjan. That was great. So what kind of self-repair are we talking about? We're going to look at that a little bit more. We're going to begin with this very simple case that was submitted by Dr. Fernando Pena. He's an ophthalmologist practicing in both Latin America and the United States. And we selected this case because it's a very simple yet demonstrative case, in the sense that it shows very clearly the self-repair process, because if you look at the slide, you see the blood in the sclera of the eye, the white of the eye, and this is an acute condition that would resolve itself given time, which would be 2 to 3 weeks. But coMra-Therapy was applied, and with that, the condition was resolved in just a few days. So just like it says on the slide, 7 times the acceleration of the self-repair process. Okay? And we want to show you this because, we could talk about it, but to see it is a different thing. And this is the kind of results you can get with coMra-Therapy. Now, of course, this is a more or less healthy eye, and we're greatly speeding up that self-repair process, making it more efficient with the application of coMra-Therapy. This resolves in a couple of days. But when you have a chronic or long-standing condition, it's going to be a lot more than 3 days. And just being realistic, it's going to be 3 months, or if you're certain demographic / category of people where you're older or you're on a lot of medications or you've got a really severe chronic debilitating disease, you may need to have this for the rest of your life in order to maintain vision so you can keep that quality of life. And we're going to go into this more in the workshop, so I hope you'll join us. So this case here, as I say, clearly demonstrates that self-repair process and the acceleration or increasing of the efficiency of that self-repair process. And now we'll move on to some more cases. So let's go to the next slide. Now this is intraocular pressure in glaucoma with drug complications. So very short story. The challenge this lady had is that if she took the drugs, the pressure would go down somewhat, but she would get a lot of stuff happening in her body, allergic reactions. If she didn't take the drugs so her body felt good, then the pressures were creeping. She tried a lot of different things, done lots of different types of the drugs for the pressure, but nothing was really helping her. So the lady's in her 50s, she was diagnosed in 2011, and her intraocular pressure, again, you want to come to the workshop, ask the questions, we can go into more detail, but it's been raised and up and down and different things, but always elevated. She'd got a trabeculoplasty. That's where they use that invasive laser to drill little holes so that to relieve the pressure, but that didn't work either. So at the end, the drugs weren't really holding the pressures anymore, and this is where they started with coMra-Therapy with her. So you can see optic nerve. Now this inferior rim thinning is an indication of the glaucoma, and again that's that pressure on the optic nerve and causing damage. So next slide. So her visual acuity normal, and as I said, she had allergic reactions to the IOP drugs, and this is skin rash, face and neck, so very uncomfortable from what I understand. And then with treatment, she's got improvements in her pressures. In fact, they'd never been seen so low. They're around 14 in each eye. Also with this, remember what we were talking about before, that increased cellular repair process. As that gets more efficient, it can resolve some of the vision problems, and this is what we see here, this increase in the visual fields. So this is very beneficial in showing, again, we're showing that self-repair process being enhanced, not only for the pressure, but also improving the visual fields. And of course, rash is gone. And I just want to take a second to talk about that because, and we'll get into this more in the workshop. Again, as I said earlier, it's not just the eye condition. There's other things that can be happening in the body that are related. So you can learn about treating those as well so that you'd have a more comprehensive, a more holistic approach to tackling whatever health challenge you're dealing with. And coMra-Therapy is obviously very beneficial in that, as we're going to see as we go through some more of these cases. So next we have a lady, 95 years old. Okay, so she's got macular degeneration. She's got both wet and dry. And she's had a serious deterioration in her quality of life over the last 5 years when this case was submitted. And she had cataract surgery previous. Now, they did the standard test, this fluorescent angiography. In the right eye, they found wet, age-related macular degeneration. And in the left eye, they found dry. And that's through the testing. And her right eye, count fingers. So that means she could no longer see the eye chart. So you had to stand closer and she could count fingers at 6 feet or 2 meters. And then her left eye, no problem. I mean, impaired, but 20/70. Nothing like the right eye. Oops, excuse me. So now after the treatments, went for the checkup, and you can see here on the slide visual acuity. So she got some improvement in her acuity in her left eye. And Dr. Pena said, look, this is a significant improvement with no other therapies applied. Now, this is mentioned here because in a practice, people will go in and that doctor, that therapist is going to use all the tools in their arsenal, all the tools in their toolbox to tackle whatever the health challenge the person is facing. And in this case, Dr. Pena said, look, I just used coMra and this is the results that we got. And also more and more people now at home are taking that comprehensive, holistic, integrative approach in tackling their health challenges. And coMra dovetails perfectly into all of those, as well as it can be used to mitigate the side effects of the drugs, as you saw in the previous case. So next we go to the other eye, her right eye, and we see she went from counting fingers at 6 feet to being able to read 2400. Now that letter, if I'm not mistaken, is almost the size of my head, so that's a big letter, but still it's a massive improvement in this wet macular degeneration. And this is a lady who's 95, so excuse me. Again, we're in this case where it's great to go to the doctor's office, get the treatments, but you really need to have this at home in order to be able to maintain the vision and keep going with treatments and maintain the progress. Because, you know, as we get older, that self-repair process in the body doesn't work as efficiently. So we need to support that in order to maintain our quality of lives. Okay, let's go to the next slide. Now, this next one is proliferative diabetic retinopathy, again from Dr. Pena. But instead of me presenting this case, what I'm going to do, I'm going to have Dr. Pena is on the video and he's going to present this one.
I'm an ophthalmologist and I mainly do cataract and refractive surgery in the anterior segment of the eye. I have been involved in some alternative treatments for eye conditions. I introduced the coMra-Therapy and microcurrent, and I'm very amazed of the results of these two. So I'm going to present a report of an improvement of visual acuity in a patient with proliferative diabetic retinopathy. Diabetic retinopathy is a very severe condition, and usually what we tell the patients, and we have taught to tell the patients, is that normally there is no improvement of vision. We can treat the eye to stop the progression of the disease, but we cannot recover vision. That is something that is been taught in ophthalmology. So that's why I was very amazed of having improvement in this patient. The red arrows show what this patient was having in the initial visit. So she was having a mixed diabetic maculopathy, a retinal hemorrhage, and vitreal hemorrhage. So the patient corresponds to a woman, 63 years old, who was first seen in October last year, consulting for progressive loss of vision and blindness. She had a history of diabetes mellitus, diagnosed 5 years earlier, receiving medical treatment with insulin. She also had a history of systemic hypertension, treated with losartan and amlodipine, and she had a cholecystectomy 9 years previously. She was referring, and also her family, about a severe limitation of her daily activities due to the loss of vision, and very often required the aid of other family members in order to walk, eat, and do other personal activities. She had a strong deterioration of her quality of life because of her blind condition, and she had lost appetite and become intolerant with others for this emotional condition after she got blind, and often angry with a very bad mood. So according to the clinical findings and at the office, this woman was having in the right eye the visual acuity of only light perception, and in the left eye, count fingers at 50 centimeters. The conjunctiva was congested. She had a pseudophakia in the right eye, which means she had a previous cataract surgery, and a mild opacification of the lens in the left eye. Her intraocular pressure was normal, 18 and 17, and the retina was attached with multiple intraretinal hemorrhage and a vitreal hemorrhage with neovascular proliferation and macular edema in both eyes. Some other tests were in general normal, except for these two here, the creatinine and the bone, which shows that she was also having some degree of the kidney compromise, a very important compromise of the kidney. After the second week, she started to refer some improvement in her visual acuity and her general mood. On November 8th, the visual acuity in the right eye was hands movement with a little improvement at 1 meter, and in the left eye was 2400. This was a very impressive improvement for seeing only fingers at 50 centimeters, and after this to be able to see the big letter of the Snellen chart at 6 meters. When comparing the vision before and after the treatment, before she could not walk alone by herself and neither recognize objects farther than 50 centimeters of distance. She was not even able to see me, but she could see the shadow. And at the end, she was happy finally seeing each other. After the treatment, she was able to read the big letters on the Snellen chart at 6 meters, recognize people and walk by herself. And at the last visit, she came smiling to the office, and this attitude was not observed in the first visit or during the previous visits. In conclusion, although there is an increasing number of alternative therapies for diabetes, there are practically no reports of its benefit on diabetic retinopathy. For this reason, the case presented here we consider is very valuable when showing an improvement of vision with the coMra-Therapy associated with other alternative procedures. So we can say that the coMra-Therapy and the microcardium and the homeopathy can synergize to work together to improve the condition of this case for her eye condition.
Okay, so now we heard from Dr. Pena with the diabetic retinopathy. Now we'll do the same thing again with Dr. Lori Chaikin, and she's going to speak about retinitis pigmentosa.
Just a little bit about myself. I am an optometrist and an occupational therapist. I work in a private practice. I specialize in visual rehabilitation, stroke, head trauma, low vision, working with retinitis pigmentosa, macular degeneration, diabetic retinopathy. This is a case that was a prior patient of mine, and I had seen her years ago. So she called me last year and said that she had just been diagnosed with retinitis pigmentosa by University of California in San Francisco. And she said, I'm losing my vision, and they said I would be going blind. Is there anything at all that you know of that I could do to save my vision? So I was thinking about a few things. One was the microcurrent, and second was the coMra. And so we started working together. And a little bit more about her history. She's a 57-year-old African-American female with complaints of steadily diminishing vision to the sides and below. She had great difficulty seeing at night and adjusting to light changes. So when she walked from light to dark and dark to light, she was tripping and falling frequently. In March of 2014, she was finally diagnosed with retinitis pigmentosa. She also has a history of HIV and is a borderline 2 diabetic. Her initial objective findings were her central vision wasn't bad, not 20/20, but just a little reduced, 20/30. Her contrast sensitivity function was significantly depressed. So that affects people when they're walking from dark to light and light to dark, just exactly what she noticed. So that was there was no function whatsoever at very high spatial frequencies, so like looking at small letters at low levels of light. And it was also depressed with medium spatial frequencies and low spatial frequencies, so larger print or larger size objects. Color vision was moderately impaired. Depth perception, or stereopsis, had initially improved after vision therapy, but had declined when I recently tested her to just 200 seconds. So that's basically significantly impaired. Difficulty with making spatial judgments like stepping off a curb, reaching for things like that. Her Goldmann visual field was severely impaired. The OCT, which is the measuring of the thickness of the different layers of the retina, was also showed severe loss of some of the layers of the retina, outer retinal layers, throughout the macula, throughout the peripheral retina, although there were small islands of vision within the macula that were preserved. An ERG was also done, which is the electroretinogram, which is measuring impulses directly from the retina to see what kind of activity there is, and this was showing severely reduced levels below normal. Overall, her vision loss was consistent with retinitis pigmentosa. This is her initial visual field that I took with a stereocampimeter. So this shows a very small field of about 10 or 15 degrees, so about 15 degrees lengthwise and about barely 10, maybe 7 degrees widthwise. That's the right eye, and the left eye is showing a little bit more, so maybe about 15 degrees laterally, horizontally, and about 10 degrees horizontally. Our first treatment consisted of microcurrent, because that's what I had been doing. And after about the 5th session, she started to report she feels like she can see with more confidence. We remeasured the visual fields, and to just show you right eye comparison only, this was before, and this was after the 5 treatments. So this is at day 1 and day 18, right eye only. And then left eye comparison, day 1 to day 18 of the left eye here. So really significant improvements already. At that point, I started to add the coherent multi-radiance laser. So these are her visual fields. Let's see, that was probably about a month, did them at 1 month intervals. And then 1 month after that. So you can see there's a huge expansion. This is again the right eye. So we've got about 40 or 50 degrees of field looking along this way and about 40 or 50 here. And also a very nice expansion before. This is the blind spot. And they're a little bit larger than normal, but at least she has one. And that's a normal blind spot. That's where the optic nerve exits out of the back of the eye. So large expansion in the left eye as well. Then August, continuing to expand. The field is changing. In some areas, it almost seems like it's a little bit, but in other areas, it's a little bit more in each eye. This is the test of contrast sensitivity in the before condition. The red is the right eye, the green is the left eye, and the normal range is this shaded area here, so severely below normal. And then at the final testing in August was all within normal range, which is just stunning. This was the Goldmann field that was done by UCSF before and after. And what she had initially was just a tiny target, a 1 millimeter target, is this area right here. They also did a 4 millimeter target here initially, right eye before and then afterwards. So this is the corresponding 1 millimeter area, and this is the 4 millimeter target. So this is an external documentation of improvement. And then this is the left eye. This spot here was the 1 millimeter target. Left eye before, 1 millimeter target after, and the 4 mil target before, 4 mil target after. So again, documenting externally huge improvement. Subjective comments. Early on, she was saying, I'm feeling better emotionally, feels like peripheral vision is increasing on the side. I'm definitely seeing better on the side. Later on, I'm seeing better inferiorly. Tripping over things less, depth perception is getting better. I can walk down the steps with much better speed and confidence. Summary of improvements: best corrected visual acuity increased to 20/20 in each eye, expanded visual fields via stereocampimeter and Goldmann, normalized contrast sensitivity, stereo depth perception improved from 200 seconds to 63 seconds, so almost normal. Color vision shows definite improvement, still missing 2 plates on blue-yellow. And the OCT had not been repeated at UCSF because no changes were expected. ERG repeated at UC Berkeley. Some improvements, some responses are now present, especially to the 30 hertz flicker that were flatlined initially. Definite subjective improvements. And then we had decided after that to back off and do treatments every 2 weeks instead. However, we found that things did not, the field began to decline, and we reduced, we decided to begin to apply them twice a week to see if we could get some gains again. She definitely was getting reducing fields. So there has been, since then, we've been doing twice a week treatments. There has definitely been some recovery back to initial gains, but we never got back to the initial gains that we had originally back in August. Just to understand that this disease is progressive, and we hope to be able to continue to hold on to her remaining vision for as long as possible by doing this treatment. We would never expect to see improvement at all. The ophthalmologist at UCSF is really pleased with the response, and that's an outside observer, an objective observer.
So now we've heard Dr. Pena and Dr. Chaikin, and we've had a look at a few things. Increasing that efficiency of that self-repair processes in the body is really a must for health, and not only health, but also recovery from disease. And this is what coMra-Therapy does. Even if you, let's say you remove all the damaging factors impacting your health, those external factors, such as, toxins and poor nutrition. Once that serious cellular injury happens, in other words, that disease process, diabetic retinopathy, whatever it is, once that process happens, that inherent self-repair system may still be too weak to function properly. So you end up having tackled only part of that health challenge. And that's where coMra comes in, because you can increase, as we already said, the efficiency and function of those processes safely and effectively. And you can do this very simply, incorporating it into your lifestyle anywhere, anytime really. And you'll see, once you incorporate it, how you and your body benefit. Firstly, your physiological health. So it's going to increase the speed of healing. It's going to increase the efficiency of the healing. In other words, let's say if you had a cut, the scar would be healed much more, there'd be far less scarring, if any at all. That's what I mean by that. Increased speed of healing from illness, like if you get the flu, that kind of thing. We're going to go into that stuff more in the workshop, which I hope you'll attend. And then I want to state too that when you look at all of this, there's really a bottom line, and I talked about it at the very beginning. When you become an active participant in your own healing process, it has a very powerful effect that nurtures and grows inside of you. So that's really going to support your physical health, your mental health, your emotional health, and your spiritual health. And at the end of the day, as I said at the beginning, we're all about helping people to help themselves, and this is how our gesture of empowering the individual through holistic self-sufficiency. coMra-Therapy is the expression of that. So, like I said, I hope you'll sign up for the workshop or take your next steps with coMra-Therapy if you feel that this is something you resonate with. And if you're not quite sure, you can always ask questions. We're happy to speak with you. And wherever your journey takes you, we at Radiant Life Technologies, we wish you the very best of health and the very most of life. Thank you.